Welcome to the Bone Clinic, Part 1 for Anatomy and Physiology 1. I'm just going down the bone list for Dr. Nelson's class. So, starting at the top on the skull, the first bone is right here. This is the frontal bone, right here on the forehead of the skull. Then we have paired parietal bones. These sit here and here at the top of the skull. The temporal bone is also paired. It is found here and here. The occipital bone is found at the back of the skull, right here. There are several sutures that bind the skull together. The first one is the lambdoid suture. It is found in a horseshoe shape right here, and it divides the occipital bone and the parietal bones. The squamous suture is found on either side of the skull, right here, again in a horseshoe shape, and it divides a little bit of the frontal bone, a little bit of the parietal bone, and a little bit of the occipital bone. It's found right here, squamous suture, and again on the other side, right here, squamous suture. Again, it divides temporal, parietal, a little bit of frontal, and a little bit of occipital. The coronal suture is found on the very top of the skull. It runs horizontal across the top of the skull right here, and it divides the frontal bone from the two parietal bones. The sagittal suture runs vertically down the center of the skull right here, and it divides the two parietal bones. The sphenoid bone can be seen two places, the first of which will be inside the eye socket, and then the second is if we open up the top of the skull, you can see it from the inside as well. So when we're looking inside the eye socket, right here on this outside portion, this is part of the sphenoid bone, here and here. If we look inside the skull, this winged shaped structure right here, this is all sphenoid bone. Right here and right here, sphenoid. The ethmoid bone is visible inside the eye socket. It sits medially back here at the back of the eye socket, way back in the back. So we have sphenoid on the outside, ethmoid medial on the inside, on both sides of the eye socket, here and here. Let me get my pointer. So back here, back here, this is ethmoid bone, and here, ethmoid bone. Okay? The lacrimal bone is found right here at the edge of the eye socket on both sides where the tear ducts would be. So right here is the lacrimal bone, all in this area right here. And then the nasal bone sits right here at the top of the nose. The vomer is found inside the nose. It's what helps to create part of the nasal septum right here inside the nose. And it's also visible from the underside of the skull right here. This bone right here in the center, this is the vomer. The zygomatic bones are the cheekbones found here and here. The maxilla is found here. It's the top jaw. The palatine bone is found where the roof of the mouth is. It forms the hard palate. Now we come to a few structures, the first of which is the external acoustic meatus. That simply means your outside ear hole. We have two ears, hopefully, so we have two external acoustic meatus. One here, and one on the other side, right here. Okay? The mastoid process is found right behind the external acoustic meatus. It's this knot that sticks down right here behind the ear. And again on the other side, right here. This knot right behind the external acoustic meatus. The styloid process is found on the base of the skull. There's two of them. One here. Let me turn it this way so you can see it better. One here. It's this long, pointy thing here. And one here. Again, this long, pointy piece here is the styloid process. It resembles a stalagmite or a stiletto heel. Styloid process. If you're looking at the base of the skull, you can see the tips of them here and here. Styloid process. The foramen magnum is this large hole here in the base of the skull that lets the spinal cord traverse through. You can see it from the inside as well. Foramen magnum, this large hole. The optic foramen is found inside the eye. It sits very medial. I'm going to put my pointer through it. See where my pointer comes out? Inside the eye socket here. Right here, through this little perfectly round hole here at the back of the eye socket. This is the optic foramen. See here? And then again on the opposite eye, right here where my pointer comes out in the back. I'm moving it around so you can see the pointer. The pointer is inside the optic foramen back there. It's also visible from the top of the skull. It has two little horns that kind of mark it here and here. Okay. The sella turcica, or Turk's saddle, is visible from the inside of the skull. It is right here, sits in the center of the sphenoid bone, right here. Turk's saddle. Okay. The mandible is the bottom jaw. Going to detach this one. Give me just a second. The mandible is the bottom jaw, and it has two structures on it called mental foramen. That is this small hole here, right there, and then there's another one on the other side, if I can move this sticker. Right here, mental foramen on the mandible, bottom jaw. Alright, that concludes the skull. Now let's move on to vertebrae. We have three types of vertebrae, the first of which are cervical vertebrae. So this is a cervical vertebrae. Cervical vertebrae are distinguishable in the fact that they have three holes. These two holes here on the side, here and here, are what's known as transverse foramen. This large central hole found in all vertebrae is the vertebral foramen. So cervical vertebrae are all distinguishable because of the three holes they have, the two transverse foramen that all cervical vertebrae contain. Thoracic vertebrae are identifiable in that they all resemble giraffes. When you're looking at it from the front here, see, here's the giraffe's nose, and here are its little horns and its ears. Just looks like a little giraffe face. So thoracic vertebrae only have the one central vertebral foramen. They lack the transverse foramen, and they look like small giraffe faces. Lumbar vertebrae are distinguishable in that they resemble a moose somewhat. To use a little bit of imagination to see it, but here's the large moose nose and the kind of hangy down things that moose have, and then the big moose antlers on either side. Lumbar just have the one large central hole, the one large vertebral foramen. So this is a lumbar vertebra. And I will hold up the thoracic so that you can see the difference between the two. The top one is thoracic and the bottom one is the lumbar. I have another example of a lumbar vertebra here. So again, this is lumbar vertebra, and the top one is thoracic. Okay, there are a few parts on the vertebrae that you should know about. First of all, the spinous process. The spinous process is nothing more than this part here. It's going to make the nose of your giraffe or your moose. So here, spinous process. This front part here, the nose of the giraffe or the moose. Okay. Transverse processes are going to be the ears of your giraffe here and here, or the antlers of your moose here and here. These are transverse processes. Okay. To have an intervertebral foramen, I must have more than one vertebra. So if I stack two of them together, like so, we end up with this space in between right here where my pointer is coming through. This is the intervertebral foramen, in between two vertebrae. And this space, this intervertebral foramen, allows for nerves that branch off of the spinal cord to pass through and go to the rest of the body. So this space in between two stacked vertebrae is an intervertebral foramen. The vertebral foramen is the large central hole in each vertebra that the spinal cord would pass through. Transverse foramen are only found on cervical vertebrae. Again, they are the two holes on either side, here and here. This lets the vertebral artery pass through to get to the brain. The body of a vertebrae is nothing more than this large bony part right back here. This is the body of the vertebrae. And obviously the thoracic vertebrae have a pretty large body, but the lumbar vertebrae have an even larger body. Okay, there are two particular vertebrae that we need to know by either name or number. They are C1. This is C1, and its name is Atlas. C1 is nice and flat, has a very large vertebral foramen, and of course the two transverse foramen. This is the very first vertebra in the neck, C1 or Atlas. C2 is known as axis. This is C2. Axis. This is the second vertebra in the neck. Again, it has the three holes, see, here and there, as well as the large central vertebral foramen. So this is C2, axis. Okay, so side by side, here is C2 and here is C1. This is Atlas. C1 is Atlas. C2 is axis. You also need to know the vertebra numbers, and an easy way to remember that is breakfast, lunch, and dinner. We have 7 cervical vertebrae. These sit at the top of the spine from the neck to almost the shoulders. We have 12 thoracic vertebrae that sit in the middle of the back, and we have 5 lumbar vertebrae. So just remember, breakfast at 7, lunch at 12, dinner at 5. Cervical, thoracic, lumbar. Okay. And rounding out our vertebra, we have the sacrum and the coccyx. The sacrum and the coccyx are nothing more than fused vertebrae that are at the very end of the spinal column. So this large top part here, this is all the sacrum, and then down here is the coccyx. It's commonly called the tailbone. So sacrum and coccyx. Okay. Then we come to my favorite bone. This is the hyoid bone. The hyoid bone. The hyoid bone is special in that it's the only bone in the body that does not articulate with any other bone. It sits under the skull and is attached through tendons and ligaments to the styloid process. This bone is commonly called the hangman's bone because if you go and become a forensic investigator and you think that someone may have been strangled or choked to death, then you would check to see an autopsy if this bone is crushed. So the hyoid bone looks like it has some little vampire teeth there. Hyoid. And then we come to the clavicle. This is the clavicle. The clavicle is very rounded. It's kind of S-shaped, commonly called the collarbone. This is the clavicle. Not to be confused with a rib. Ribs come in a variety of shapes and sizes, but they are usually distinguishable in that they are flat and they are C-shaped. So this is a rib. This is like the very first rib that sits right underneath the clavicle at the very top of the rib cage, but this is a rib. Okay? This is also a rib. This is a floating rib down towards the bottom of the rib cage. And then also a rib, flat, C-shaped. Okay. When we're looking at the sternum is composed of 3 different fused bones. At the top of the sternum is the manubrium, and then in the center you have the body of the sternum, or the gladiolus, and then here at the tip you have the xiphoid process. Okay. You also need to be able to determine true ribs from false ribs. True ribs attach directly to the sternum. False ribs, like in the case of these bottom 3, see how they attach together and then come up and attach to the sternum? That is what makes them false. So the first 7 pairs of ribs are true ribs, and the bottom 3 are false ribs. And then remember that we also have 2 more pair of floating ribs that do not attach to the sternum at all. So for true ribs, 7 pair. False ribs, we have a total of 5 pair. And 2 of those 5 pair are floating ribs in that they never attach to the sternum at all. So this concludes part 1 of the Bone Clinic. Check out part 2 and part 3 as well. Thank you.